Good afternoon, it's Dr. Larson talking about COVID-19. So I'm going to talk about boosters, but I'm just going to quickly talk about what's happening in Kittitas County. So our numbers are going down. We still are very high transmission, over 500 cases per 100,000 per 14 days. To be in low transmission, we need less than 25 cases per 100,000 per 14 days. So that shows you kind of where we're at. So still a lot of COVID out there. Have 4 people in the hospital currently with COVID-19. And Central Washington University has 93.4% of their students that have turned in all their paperwork, which was 8,345 students, fully vaccinated. So that is helping our community because we are not seeing COVID-19 from the college this year like we did last year. We are seeing a lot of COVID-19 in schools, not in school transmission, but people who are coming to school with COVID-19. So schools are doing a really good job with masking and social distancing, testing, and the Test to Stay program, which is a program, it's a state program that the schools are doing that instead of putting somebody in quarantine who might be a close contact to somebody who has COVID, they're testing those students to stay in class. It's a modified quarantine. It does not allow those students to continue with sports or work or those type of things, but it does keep them in class where their activities are a little bit modified in class by teachers watching to make sure they're keeping their masks on, etc. So schools are doing a really good job despite having lots of COVID, and our numbers are coming down. That said, we still have 48% of people in Kittitas County that have not gotten vaccinated. That includes some people who up to now have not been able to get vaccine. Those are those students and children under 12 years of age. So if you haven't gotten vaccinated, vaccine is safe. It's our way out of this, and it's readily available in Kittitas County. I'll end with childhood vaccinations, which aren't approved as of yet, but for those 5 to 11. But I'm going to talk a little bit about boosters. So we know immunity wanes with lots of vaccination. Vaccines are still very powerful tools to keep us out of the hospital and keep us from dying. Somebody older than 65 has an 11 times higher risk of dying of COVID than somebody who is fully vaccinated. So it's keeping us out of the hospital, it's keeping us from dying of COVID, but our immunity wanes over time. So Pfizer vaccine has been approved for boosters, and now as of this week, Johnson & Johnson and Moderna vaccines have been approved for boosters. They're all a little bit different vaccines. I'll just start with Pfizer. Pfizer vaccine is the same dose that we received previously. It's a third dose, has to be given 6 months after your second dose of Pfizer, and that increases the antibody response to back up to being above 95% effective at preventing disease. People that should be getting Pfizer vaccine, people older than 65. Currently, we only have 1 out of 7 people in Kittitas County who are older than 65 who've gotten their boosters. So you can get your boosters at KVH, you can get your boosters at multiple pharmacies. You don't have to be a patient at KVH to get a booster, you just have to call them. So call your pharmacies and figure out who currently has Pfizer vaccine. Other groups that can get Pfizer, people 18 to 49, people with multiple risk factors that are younger than 65, people that work in long-term care, and anyone older than 18 who either lives in a high-risk situation, they might live in a nursing home or a long-term care facility, or work in a high-risk situation, such as teachers, students at college, those type of things. So lots of ability for those people to get Pfizer. Now, Moderna vaccine and Johnson & Johnson vaccine, as I said, they were approved. They're available here in town. There's a lot of talk about mix and match. It does make some sense if you've gotten a Johnson & Johnson vaccine to consider getting one of the mRNA vaccines. You're changing vaccine. Your body's seeing something a little bit different, and the immune system boost in that situation is really quite good. And if you have some concerns about, well, I don't want to risk getting a second Johnson & Johnson vaccine, you might consider getting a Moderna or a Pfizer. If you're in Johnson & Johnson vaccine, it's 2 months after your first dose of Johnson & Johnson vaccine, you can get a booster. In Moderna vaccine, again, that's an mRNA vaccine similar to Pfizer. There's not really a whole lot of science between, well, if I got a Moderna, I should get a Pfizer. You can kind of get whichever one you want, and what my recommendation is, get the one that's available at the pharmacy that you go to. So that's going to keep you out of the hospital. It's going to help all the rest of the people in the county, again, those 48% that are not vaccinated yet. And for those people who are not vaccinated, please consider getting vaccinated as we move indoors in the winter. We're going to have more COVID. We're going to have another spike, maybe not as high as we just had with the Delta variant, but it is concerning. Next Tuesday on the 26th, Pfizer vaccine for children 5 to 11 will be looked at by the ACIP, the American College of Immunization Practice. The data is really strong, it's safe, it's effective. I would expect it to be approved and available in Kittitas County the first week of November. We are planning vaccination clinics here at the health department, and I know KVH is planning vaccination clinics for children ages 5 to 11. So those vaccines are available. And the other vaccine to think about is flu vaccine. We didn't have much flu last year because we were all inside, we were all wearing masks, we were all avoiding each other. We had one flu death in children last year. Usually we were in the multiple hundreds of flu deaths in children less than 5 years of age, but we only had one last year. I think we'll have a bigger flu season this year because a lot of us are out there not wearing masks, doing more things. So please get your flu vaccine. To put that in perspective, we had one flu vaccine death last year in children less than 5 in the United States. In Washington State last year, we had 13 COVID deaths in children less than 19 years of age. So COVID did affect children. Please consider getting your children their vaccination for COVID as well as influenza. And have a good weekend. Thanks a lot.